everyone, my name is Emily Ernest and I'm from Beckley, West Virginia. I'm a third year medical student here at WVU and I'm here to tell you a little bit about what it's like to be a med student during this quarantine. This is our curriculum. So I am in my third year of the curriculum, which means that I am completely clinical right now, just like the fourth years. The first and second years, you're doing all your lecture things, but once you transition into third year is when you're in the hospital, you're in clinics. Your main form of learning is through patients and patient interactions with a sprinkle of lectures. So when the quarantine started, the deans, administration, clerkship directors, they all had to really be creative to come up with a way to mimic that patient interaction online, because we are now completely virtual. And the deans and everyone, clerkship directors, have done an excellent job of converting us to virtual. So I'm actually on my psychiatry rotation right now, and for instance, a typical day for us would be having a Zoom lecture and then watching a patient video where someone would mimic, for instance, like schizophrenia. And we would write a note about that, turn it in, and receive feedback. And that would be our everyday thing. For someone on surgery, for instance, I know they're doing virtual suture workshops. So they have kits, and then they'll practice with the clerkship director and show, how they did it. It's a really neat and creative way. And honestly, I feel like I'm still learning, even though we're not in lectures and interacting and everything. So one particular challenge, especially for third years, and this goes across the country, is that like everyone, our plans are muddled. They've been uprooted and we don't know our path to residency, how that's particularly going to go. Everything is uncertain, and so we trust the administration and everyone. We know they'll make the best decisions possible to get us where we need to be. And with all this stress and uncertainty, just like everyone else, we have to find ways to cope, ways to stay positive, stay sane. Everyone has their own different ways of doing that. Personally, I'm exercising a lot, staying active, walking a ton. I'm also playing with my cat Luna, like all the time. She is adorable. And then FaceTiming my friends and family as much as I can. So for those of you who are wondering where I'm doing my video from, it's from somewhere I walk by all the time nowadays on my quarantines. Law School Hill. See? See, here's the stadium, boom, and here's Ruby and HSC right there. From all the students, medical students at WVU, we want to say a huge thank you to everyone on the front lines who is working hard to keep our community and our world safe and healthy. We can't express our appreciation enough, and we hope you all stay safe and healthy as well.